All right, so in this video, what we're going to look at is the difference between keratinized cells versus non-keratinized cells. And this may sound confusing, but really it's not that confusing. So let's look at the layers of our tissue. So as we reviewed in the previous video, we have the epithelial tissue, which is on the outer surface. And then we have your connective tissue, which is underneath. That's where you have the blood supply. And then underneath that, we have the bone. So if we're looking at our hand, what we're seeing, the first thing that we see is our skin. And the skin is your epithelial tissue. Underneath the skin, we have connective tissue, which is where your blood supply is. And then we have the bone underneath that. So when we say something is keratinized, okay, keratinized is basically it's referring to your epithelial cells. So it's referring to these cells. It's referring to these cells over here. So these cells could be keratinized or they could be non-keratinized. And let's look at the difference between the two. So if I go down over here. Okay, so keratinized. Okay, so I'm just going to write down keratinized cells. Okay, so keratinized cells are strong. I want you to think of keratinized cells as something strong, and I'll give you some examples. And you can also think of something waterproof, where water won't be able to go inside the skin. Okay, so it's kind of waterproof and it's strong. It feels hard. So think about your hand. Your hand is, if you look at the skin, it's waterproof. So there's a lot of the cells on your hand is waterproof in the sense that water cannot seep through the skin cells. Okay, so keratinized cell is something strong. It's something waterproof. It's also cells that have no nuclei or no nucleus. I'm going to say no nuclei. So remember how when we have cells, there's usually like a nucleus in the middle? Well, in the keratinized one, there is no nucleus in the middle. In our body, the most heavily keratinized or strong and waterproof part in our body is our palm, so the palm of our hand, and it's also the bottom of our feet, the soles of the feet. That is the most keratinized body parts we have in our body. Now I'm going to focus more on, what we're more interested in our oral cavity, in our mouth. But before I do that, let's look at what non-keratinized cells are. So let's write this down. Non-keratinized cells. So non-keratinized cells, they are soft. Okay, so instead of it being strong, it is now soft. And it's definitely more flexible. And this is the key thing over here, that is more flexible. That's how you can distinguish between a keratinized and non-keratinized thing. So we'll look at that. And the cells have a nuclei. So if I'm looking at a cell, there is a nuclei or a nucleus inside there. So let's look at this picture over here. This is someone's mouth. And the first thing we're going to look at is the gums. So here's the gums. Okay. Do you guys think the gums are keratinized or non-keratinized? Are they strong? Are they hard? Or is the gum soft? Can you move the gum? Can you flex the gum? So your gums are keratinized. So if you look in the keratinized section, gingiva is keratinized because it is strong. I cannot flex my gingiva. I cannot flex my gums. It's also waterproof. Water can't really seep through the keratinized cells. Okay, let's look at the next one. I want you guys to look at this over here. So alveolar mucosa, which is this area that I'm outlining here. So if I pull my lip and I see my alveolar mucosa over here, and then further out is my labial mucosa, is that strong? Is that hard? Or is that soft? It's soft because it is flexible. I can move, right? I can flex, I can move, I can squish with my hand. I can move it, I can squish my mucosa. So your alveolar mucosa, your lips are considered non-keratinized because it's soft, it's more flexible. And think about your lips. You can purse your lips. You can, you can open your mouth. You can open your lip. Your lip is also considered non-keratinized because it's flexible. It's soft. let's move this over here. Your hard palate, okay, so this is your hard palate, and then at the back we have our soft palate. So hard palate, is that keratinized or non-keratinized? Your hard palate, hard being the key word here. So if you look, anything that's strong, I should also say anything that is hard is keratinized. So your hard palate, because it's so hard, it's keratinized. But your soft palate is not keratinized. And the reason why it's not keratinized is if you put your tongue on the soft palate, you can actually see it bounce up and down. You can actually move it ever so slightly. So that's why it's non-keratinized. So if you look over here, soft palate is non-keratinized. Alveolar mucosa, your lips, your cheek, your buccal mucosa. So your buccal mucosa is your inner cheek. You can flex it, right? Because you can play with your cheek. You can pull out your cheek. You can pull, you can play with it. It's flexible. Your cheek is flexible. That's why it's non-keratinized. Soft means non-keratinized. The floor of the mouth. So if I were to open my mouth and look in the bottom of my mouth, it's softer. It feels soft. Because it's soft, it's non-keratinized. Now, another thing I want to point out to you is something called the oral epithelium or outer epithelium, junctional epithelium, and sulcular epithelium. So I'm going to show you a picture, a really poorly drawn picture. And we'll look at this in another video, but the outside of your gum, so this over here, the outside of your gum is considered keratinized, and that's what we said, right? The outside of your gum is keratinized because it's hard. You can't flex it. But the inside of your gum, so if you're looking at the sulcus, so this area here is the sulcus, which is where I usually probe. If I'm probing in this area here. That is actually more softer than this area over here. So sulcular epithelium as well as your junctional epithelium is a lot more softer. And think about it, if I were to probe in this area here, there would be a little bit of give. Like I could actually, feel the flexibility and the softness when I use my probe. And because there is that little bounce and give, and it's softer, it's known as non-keratinized. Anything that's soft is non-keratinized. So this is known as your sulcular SE for sulcular epithelium because it's in the sulcus. This area over here is the sulcus, the inside of the gum. And then your junctional epithelium is the bottom of the gum. The base of the sulcus is what we call it, the base. So if I were to probe, the end of the probe will hit the base of the sulcus, which is your junctional epithelium. And again, your junctional epithelium is soft. That's why it's non-keratinized. So oral epithelium or outer epithelium is keratinized. Some people even say it's partially keratinized or para-keratinized, which means it's kind of soft, kind of hard. But for the most part, I want you guys to think that this is keratinized. This is non-keratinized because it's softer. That's why I can probe in that area and it won't hurt because it's a little soft.